Palliative care is the care for the patients that have the life-limiting illness, or is just the illness that treatable to life. But we don't just emphasize only about the body or physical. We have to deal with what they're thinking or the feeling, emotion, is the psychological issues, and also the family, social of the patients, and also the spiritual. These all kind of issues is involved with the quality of life of the patients, that we would like them to have the best quality of life for this kind of care. The process, or what are we going to do with the patients or family in terms of palliative care, is about how the patients or family themselves think about the disease. It means that doctors or nurse or healthcare personnel, all in the team, have to know that what the patients think when they have this life-limiting illness. It means that we have to listen thoroughly. We call deep listening to what they want or what they need. Actually, for this kind of care, we don't aim to hasten life or delay the death that they have. It means that we start this palliative care since the patients know that they have this kind of disease, and also during when they have the treatment. For an example, the life-limiting illness like cancer, when they know that they have cancer, one thing that the patients will face is about, am I die in this year, or how long that I would live. So they want to know about all this information, and also the kind of treatment, the details of the treatment, like the chemotherapy, the radiation, to make the patients feel less suffering. And we just, for our treatment, one thing that important in the physical issues about the cancer is about the pain. Actually, more than 50% of the cancer patients, especially in the advanced stage, they will have suffer from the pain. And after that, we will talk about the emotion, feeling, and we try to make the day that they live is the best day for them. For the palliative care itself, for the patients and also the family, what are you going to do with this palliative care? For the patients, you have the right to receive this palliative care if you have life-limiting illness. You can open this issue with your doctors, that what you need in your life, what you need in your treatment, whatever during your chemotherapy or radiation treatment, what would you like to have when the end is come in your life. And also the family, actually you can talk with during the members in the family about what the patient needs during the treatment, what their emotion, what they're feeling, and what is the plan if they are going to die in the future. And actually for all these kind of issues, whether the physical symptoms, the feelings, the emotion, the social life, and also the spiritual things about the dying and what they believe, you can talk with the doctors or healthcare personnel, and this kind of thing will not be a mystery anymore.